Hope you're having a wonderful day. Welcome to Wellness Wednesday. And, while we're waiting to make sure everybody gets on who wants to, I thought it interesting today. I was, I got, I get these articles all the time um, from medical things, medical articles and things come into my feed. And it just never ceases to amaze me what they're researching and finding. And one of the things that they think that they've come across is a cure for lupus. So, okay, so this autoimmune disease, they're looking at this, new thing they can target, this new sort of receptor and on the immune cells that help with lupus. And it's just interesting because, okay, they might find something and then it'll take years and years for them to develop something, and then they'll think that it's the right answer for this problem. And it generally takes 10, 20 years for something to be a mainstream treatment in medicine. I don't know about you, but I don't have that long to wait. And I know that there's a lot of other things can be done for autoimmunity than wait on a drug that potentially has a ton of side effects. And who knows about the efficacy. I mean, it's interesting. We know there's a lot we can do for autoimmunity. I teach this in the master class. I help patients every day with this, with their autoimmune conditions, and they do well. They get better. They put it into remission. Come on. I mean, let's get on this now and do it the right way. Get to the root cause, right? Okay. Anyway, before I get any further, I will okay, I think everybody's good. I think we're on. Okay, so I'm going to say my disclaimer. And so anything that I say tonight during this Wellness Wednesday is just health information and should not be considered to be health advice. Don't start taking or stop taking or change the way you're taking any of your medications. If you feel like you need to do that, please first consult with your prescribing practitioner so that they can help you make the appropriate adjustments to do that safely. And attending this Wellness Wednesday does not establish a doctor-patient relationship. Now, I want to jump in and just say, during the master class, I spent a lot of time going through the 12 thyroid lab markers, right? And the 12 markers for dysglycemia, okay? And I thought it would be helpful to, if we went through some of those and other markers, to define them and explain what they mean, because when I go through them with you during your report of findings visit, it's helpful for you to have kind of a background knowledge. And to be honest, I don't get through every single marker because there's a lot. I mean, there's 120 plus markers. So I hit the highlights and the things that are most relevant to your case, the triggers and things that you're dealing with. Most of you have so many things going on when we go over, those labs with you, that I find it best and less overwhelming for you to hit those highlights and main triggers that you're dealing with as I relate them to your symptoms, because I want to give you that clear, idea of what's going on. Anyway, this way, if I skip over explaining a marker, it might be one that I talked about here so that you have a good understanding of what that means as you go back through. So as we go through things, some of these markers certainly are checked when you have like your basic blood work done with your doctor and you're told that everything looks normal and, when they are within range, right? Well, what does it mean to be in range? If you're in range, then you're among 95% who are considered normal for that test. But when 70% of us have chronic disease, and that's maybe an underestimate, that doesn't make any sense. Like for that many to be normal. So with that wide normal range, within that wide normal range, functional medicine researches what should be optimal versus dysfunctional. Ladies, if you're having symptoms and you're in the dysfunctional range for a particular marker, that is a significant finding for you. And remember, different laboratories will have different lab ranges because they are gathering different data from different geographical areas. So of course, the lab ranges are going to be different from one geographical region to another. And so when disease is evident by one lab, but not by another lab's standards, it gets very confusing and frustrating. For example, what if you were found to have an A1C, a diabetes marker, of 6.5 by one lab, and then you're at 6.4 on another lab, on another, and say on one coast, 6.5, you go to the other coast of the country, get your test done for some reason, and it's now, one number different. One number you don't have disease, one number you do. So that just has never made a lot of sense to me. How you can all of a sudden have disease at one number and not at another. And so certainly we have to look at things differently. We have to understand the process behind how our bodies are manifesting these different lab findings. And so that's where context is important. That's where looking at other systems, laboratory markers are very important. And so let's move into some of these tests and what they mean. So TSH, thyroid stimulating hormone. This is a marker that is made, it's a hormone that's made in the pituitary gland in your brain, and it tells your thyroid what to do. And I did talk about this in the masterclass, but I thought it worth, reviewing tonight. And so this hormone from the pituitary gland in your brain tells the thyroid gland to make more hormone, and it helps your thyroid make that hormone. Well, when that number is high, that usually means that hormone levels from the thyroid are low. But doctors don't usually check the thyroid hormone levels. And I'm going to talk about those next. So when TSH is low, does it mean that those levels are going to be high? So what's interesting is that no studies show that happens, that's the case. So this TSH is only a brain test, and it is helpful in testing thyroid, but only in relation to these other numbers, other markers. Okay. So again, it's important to understand that if the relationship is inversely proportional, they're inverse to each other. So TSH should be high when hormones are low, and if hormones are high, TSH should be lower, theoretically. Okay. TSH can also be low when your pituitary gland is sick. Think about that. So TSH might be low simply because your pituitary gland is not operating properly. So it will have nothing to do with your thyroid hormones at all. Okay? All right. What's T4 or thyroxine? This is one of the hormones your thyroid makes. It's the storage form for the thyroid hormone, which I'll talk about in a minute. And it is either free or it's bound. All right. So the difference between free T4 or thyroxine that's free and thyroxine, which is it's total, and it's the bound portion plus the free portion. Okay, that's the difference. So total T4, or oftentimes you'll just see it as thyroxine, is the bound portion plus the free portion. So bound to a protein that carries it through the bloodstream. It's like because these hormones don't swim, and so they need to be in a life preserver to carry them along. Okay. And so there are different carrier proteins for thyroid hormones. So that's what T4 is. It's the storage form, and it's the less active or metabolically active form of thyroid hormone. Well, then you have T3, which is the active or metabolically active form of thyroid hormone. And it gets that way when it's converted from T4 to T3 in the liver. Okay, mostly. Okay, some of it's converted in the tissues, like in the brain, it's converted. And so the T3 loses the T4 loses an iodine, becomes T3. And there's some enzymes that make this happen in the liver and so forth. Well, that's the active form that goes into the cell, binds to the receptor at the DNA level, right inside the nucleus, and causes things to happen. This turns on your metabolic machinery. Okay, it's like the switch, or it's like the key that starts the motor. So it turns on the metabolic machinery, and away your cell goes and does its job. Okay, works properly. Well, again, T3 free, and then just liothyronine. It's actually triiodothyronine on the lab test. Triiodothyronine. Tri for 3-iodo, iodine, thyronine. 3 iodines on the thyronine. So that's why it's named that. So T3 is free, or it's triiodothyronine or total T3. Okay, that is the active thyroid hormone. Okay, and the difference is one contains the bound portion and one is just the free portion. And we need to know that free portion, because that's the really active active hormone for the thyroid. All right. What's interesting, and I need you to understand this, is that, okay, we can measure these in the bloodstream, and this is what they are in the bloodstream, but this does not reflect what's in the tissues. So there really, isn't a great way for me to test your tissue levels of thyroid hormone. Okay, so we have to look at some other things. We look at T3 uptake. T3 uptake is a marker for how well your thyroid is delivered or distributed to your body, to your cells. And so when we see, let's think about this. If your thyroid needs to be carried, needs to be delivered, right, by a life preserver, or better yet, let's think of it as a thyroid shuttle with various seats in the shuttle where the thyroid sits. Well, when your uptake is low, you don't have many available seats in your shuttle. Okay? And this can be affected by several things, mainly excess sex hormones. This can be affected by excess testosterone or excess estrogen. And most often what we see is excess estrogen, which blocks or takes up those available seats so that there's no more seats left for T3 or thyroid hormone to be distributed properly. Okay. And when that happens, it's usually that's a sure sign that you are hypothyroid, when you have a low T3 uptake. All right, what is reverse T3? Reverse T3, what does that sound like? So if we think of T3 as the accelerator or the switch to start the motor and get it going, well, reverse T3 does the opposite. It blocks that. Or maybe you can think about it like this: it puts on the brakes for the cell. And so reverse T3 has to be in your system, because if you only had an accelerator in your car and no brake pedal, what would happen? Yeah, you know what will happen. You'd crash. And so we need a reverse T3. 20% of thyroid hormone, T4, gets converted to reverse T3 in the liver. So that's why that's important to know how high that is, because if it's too high, then it's blocking T3 readily, and you're going to be hypothyroid. I mentioned that in the class that there are over 22 different patterns for hypothyroid function. You can see now why, with the combination of all of these, how there can be so many different variations or different patterns of hypothyroidism. Okay. And it's very important that we identify what your pattern is, because that's how we can fix it. We know how to fix it then. All right. So let's look at A1C. Let's talk about that. A lot of you might know this, but some of you may not. A1C, hemoglobin A1C, is, and it's part of the dysglycemia panel now. This is average blood sugar over 3 months' time. Well, why? Because the average red blood cell lives for 3 months, and then it's broken down in the liver, and it is no more. So sugar it binds to these hemoglobin molecules, okay, in the blood. And this is measured, and it comes out as a percentage. So it's a percentage of the hemoglobin bound with sugar. And so that correlates with a blood sugar average, okay? And so if you have an A1C of say 5.5, 5.6, then you're going to have an average blood sugar of 100, 111, 110, 111, okay? And this is helpful because this marker is the gold standard for diagnosing diabetes. And A1C has to be 6.5 or greater to be diagnosed with diabetes, for you to be diagnosed. So between 5.7 and 6.4, you're labeled as prediabetes. Well, that's all well and good, but it's only one of the markers that we need to really see what is going on with your blood sugar control. And so we obviously are going to check your fasting glucose levels, which is just exactly that. It's just your glucose, blood glucose levels of while you're fasting. And we'll check insulin. So why don't doctors check insulin? That's the next one we'll talk about. Insulin is made in the pancreas and in parts of your intestines. I know a lot of you may not have known that, but some is released from your intestines. So there are endocrine cells, in your intestines, enteric endocrine cells. Hold on, I think I'm going to sneeze. Get a tissue ready. Okay, maybe not. And so when you eat food, especially carbohydrates, then more insulin is released from these cells. And then there's a second release from the pancreas. Okay. What we know from functional research is that the more insulin we're producing, it's because our bodies are becoming resistant to insulin. So it's going to try harder. All right. It's going to make more to try harder. It's like if you're, if you're having trouble getting gasoline in your gas tank through the gas, open gas cap. Well, maybe if you pour gas over your car, some will get in there. A lot of it. Okay. So I know that's a little bit of extreme, but that's kind of how it works. Our cells, our pancreas is going to produce more and more. And because when we start eating carbohydrate foods like, cakes, cookies, pies, pastas, soda, drink soda, juices, bread, cereals, all this. Our pancreas doesn't know when we're going to stop eating it. And so it just knows it has to produce a lot of insulin. And so the more of that stuff you eat, the more that encourages more insulin production for the pancreas. And so if we check that, especially when we check it fasting, what does that tell us? It tells us that how much excess insulin is running around our systems and if we're going to be insulin resistant or not. So that's a big player, big marker to see what is going on, and really has a lot of health consequences, not to mention weight gain being one of the most irritating consequences of higher insulin levels. So the functional range for that, the functional range for insulin is between 2 and 5. Fasting insulin should only be between 2 and 5. But the range for insulin on regular labs is 2.4, 2.5 to 24. It's huge range. So, yeah. And so we know that a fasting insulin more than 5 is problematic and likely means you're insulin resistant. And the highest that I've seen in the last couple of years is 90 for fasting insulin. And you better believe she was having trouble. She was having trouble with energy, trouble with weight gain, brain fog, memory issues, learning, retaining information. All right. So, all right. LDH. Oh no, cholesterol. Let me talk about cholesterol first because it's another important marker in this dysglycemia panel. Cholesterol, ladies, I want you to understand this. This lipid panel that we get, it doesn't actually check the lone cholesterol marker that, to give us a sense of how much cholesterol you have in your body. It's testing for what's being carried, transported. That's what LDL, VLDL, HDL, so low density lipoprotein, very low density lipoprotein, high density lipoprotein. They're carriers carrying cholesterol. So, what does this mean, really? And why is this correlated wrongly so with heart disease and stroke? And if you look at the actual research, and I've done a whole Wellness Wednesday on this, go back and search cholesterol and listen to the Wellness Wednesday that I did. But the ranges have changed because of the drug company influence. Okay. So here we go. LDL is normal at 0 to 99. I'm sorry, ladies, but if your LDL is 0, you'd be dead. You have to have cholesterol in your system. You have to have transporters for cholesterol to bring cholesterol to all your cells in your body, because every single cell needs it. Your brain needs it. Your cells all need it. So you have to have some. And doctors used to be okay with an LDL of 200. Okay? They used to be okay with, and HDL is considered the good guy, but it's not. It's also a carrier protein for cholesterol. That brings cholesterol from the intestines and the rest of the body to the liver, back to the liver, okay, for processing, okay? And it is a marker for autoimmune disease when it's high. HDL, the good guy. It's because it's not the good guy. It's just the guy. It's just a guy which is doing its job. And when it's high, it's a marker for autoimmune disease and something going on in your gut. So if it's above 70, you're likely dealing with a gut issue and autoimmune disease. If LDL is, below 100, I would actually be worried. I would be worried that you don't have enough transporters to get cholesterol to the cells in your body. Maybe we could go a little lower, maybe less than 80, but we really don't want it lower than that. Okay? We need it. We need these cholesterol carriers. So that begs the question, is cholesterol bad? No, it's not bad. And I'll just cite a 2016 study published in the British Journal of Medicine, reviewed all the research and found that actually those with higher LDLs, especially over 60 years old, actually lived longer. Truly. Okay. And those who were not treated lived longer, had a lower mortality rate. Yeah. Flies in the face of traditional wisdom there. Okay. Let's talk about LDH. Okay. Now, lactate dehydrogenase, LDH. This is an enzyme from the liver that also tells us if you're insulin resistant or if you have a blood sugar problem. So LDH is an enzyme that converts lactic acid back into glycogen. Glycogen is glucose in storage. And you need it in storage where it can be readily accessed and converted back to glucose very quickly. So it's released from the liver, from muscles, very quickly to be used as fuel. I often look at LDH like your refrigerator. Okay, it's easily accessible. You put it in easy and you take it out easy. A little bit different than a freezer, right? You could put it in the freezer easy, which is more like fat. You can put that glucose into fat, but it's harder to get it out and use it. Okay, so fat storage of glucose is another thing. There's really not a measure for that other than recognizing some markers for fatty liver disease like high triglycerides over 100, okay, means that you probably have some degree of fatty liver disease. But lactate dehydrogenase, LDH, is this marker for glycogen storage. So it's your refrigerator. Some of you have full-size refrigerators and some of you have mini fridges. Well, wouldn't you rather have a full-size refrigerator than a mini fridge if you want ready access to glucose so that you can have the energy you need? So it's important to know lactate dehydrogenase, LDH, should be over 150, but not too much over 190 or 200 at the most. Okay, I don't really like it over 200. So about 190. And so the functional range for that is between 140 and 200. But like I said, I like it a little tighter. Optimal. Okay. And so we know if that's low, that you're not storing a whole lot of glycogen because and that's going to mean that you're going to have trouble regulating your blood sugar on because it doesn't have a place to go. It doesn't have a place to be stored properly. And it's likely going more into fat. All right. If it's higher than that, higher than normal or than optimal, then this is where you start seeing problems with where maybe your refrigerator is too big. Yeah, you don't want a big one. And this generally means that you're dealing with sclerosis starting in the liver or scarring, which leads to cirrhosis of the liver. Now, this can be alcoholic related. This can be non-alcohol related. So it's a marker for fatty liver disease as well. All right, uric acid. This is a marker for certain, this tells us how certain proteins, certain amino acids are able to break down. And some break down into uric acid. Well, this happens more often when there's fructose toxicity. So when you have too much fructose in your diet or in your system, then your uric acid will be high. This uric acid can crystallize and can collect in joints, causing gout. Well, it doesn't have to cause gout in just one joint. It can cause joint pains and issues in other joints. And this is, again, a marker for fructose toxicity. Women shouldn't have it above 4.5. Okay. Low levels of uric acid can mean there's some problems with malnourishment, like you're not eating enough protein, you're not digesting enough protein, and some kidney issues. Okay. Uric acid really helps us understand glucose regulation better. And so when it's high, above 4.5 for women, 5 in men, then we know that there's a blood sugar regulation issue. And this is going to lead most often to weight gain and, like I said before, fatty liver. Okay. Alkaline phosphatase, ALK-PHOS, ALK-PHOS, as you will see on labs. This is an enzyme in the liver that reflects bile production, okay? And this can also, when it's high, and the lab range is from, the regular range is 35 to 115, 120, but optimally it should be between 70 and 100, very tight. When it is not optimal, lower than optimal, this is a great marker for zinc. So zinc levels are best tested by testing something that it is needed for. And it's needed for this enzyme. And so this can be a marker for parasites, certain parasites. This can be a marker when it's too high for blockages in the liver, like literally bile duct system blockages. You can have liver stones. You can have more bile salts than you have bile flow. So you can have a buildup of those and they can block you. But most often these are caused by parasites, all right? And so we get these this higher number of alk phos when there's a blockage. And this may or may not manifest with any symptoms other than you have trouble with bowel movements. You might have trouble with energy, might have trouble with hair loss, right? Because when you're having trouble detoxing, when you're blocked in your liver, then you're going to detox through your scalp and skin, and that can cause hair loss. Alkaline phosphatase, like I said, is a very important liver marker. And when it's really, really high, this can be a marker for liver disease. Okay. I should go back and mention LDH is not just present in the liver. LDH is present everywhere, and it can be a marker when it's really high. It can be a marker for certain cancers, bone cancers. It can be a marker for cardiac issues or heart issues, and certainly liver issues and brain issues, brain degeneration, brain cancers, and so forth. But it has to be really, really high, like way above the standard range. Okay. GGT. This is another liver marker. It's an enzyme. This also is produced in the bile duct system. And when it is not optimal, when it is lower than optimal, optimal really is between 20 and 30 or 40. It's really, really a pretty tight optimal range. When it's low, this can also be a marker for low B6 levels and parasites. And you need B6 for hair growth, for so a healthy scalp. You need B6 for dopamine and GABA production. These are neurochemicals that we need so much. So when this is low, this is a marker for low B6 and parasites, and poor bile production as well. So you need this enzyme. We need to see what it is. It's not necessarily a trigger for autoimmunity, but it is something that I find often as a part of a pattern for parasites. All right, magnesium. It is one of the few elements that I check in the blood, mainly just to get a quick look at what are your magnesium levels, because magnesium is needed in every single cell, in every single mitochondria or energy factory in every single cell. And if you don't have enough magnesium, there are consequences. You will make too much lactic acid, okay? And then if you don't have enough LDH, then that lactic acid will build up and you will have soreness. You will have brain fog. You would have maybe dull headaches. You would have stiffness. You would have memory issues or brain fog. So a very important test to see what is going on. We can look closer at what the actual magnesium levels are, but this is a good test for this to just get a baseline. Let's see what's going on. Low magnesium can cause cramping. Low magnesium can cause like muscle cramping. Low magnesium can cause trouble sleeping. Low magnesium can lead to heart issues. Okay, low or high magnesium. All right. Fibrinogen activity. Fibrinogen, Fibrinogen activity. This, when it's high, and the functional range for this is up to like 369 between, it's between, trying to think of this, 295 and 369. So when it's higher than that, you are at risk for blood clotting. And I am finding this in people who have had the shots. I'm just going to leave it there. I'm finding this in people that have a lot of systemic inflammation. So when C-reactive proteins high, when their homocysteine is high, I'm finding fibrinogen is often high because your body's trying to compensate for the inflammation. Think about it like this. If you have systemic or vascular inflammation, it's like having a bunch of potholes in those artery roadways. And the fibrinogen is the pothole crew. It comes along and starts to fill the potholes. Well, it can fill them too much and cause plaque to build up. So it isn't necessarily a good thing to have high fibrinogen. And it doesn't get the bad rap like cholesterol gets. You start getting fibrinogen building up, and then cholesterol sticks to it. So whose fault is it for those heart attacks and strokes? Is it cholesterol? Or is it the inflammation? Is it the fibrinogen? Okay, you see my point. There are other things happening. Let's see. And then homocysteine. Let's talk about homocysteine. Homocysteine is a marker for systemic inflammation and brain inflammation. It is an amino acid derivative, and it's high when you lack certain active vitamins, when you lack B12 or folic acid and others. When you lack these active vitamins, and it's typically because your liver cannot activate them. And I'm going to get to another test in a moment that I don't get often because this happens so often. This homocysteine, when it's high, means that your liver detox pathways are not working well. And again, when it's high, over the optimal range, it is a marker for brain inflammation. And so it's a risk factor for neurodegeneration or destruction of your brain, as we see in Alzheimer's when you lose white matter, literally. We see this it can be implicated in neuropathy, okay, where your nerves are not what they should be in your extremities. So it has significant consequences when we find this marker to be high. And it's like I said, a marker for brain inflammation. So we really, what I meant to say is it's a marker for cardiovascular risk, because when it's high, it can actually target the coronary arteries all by itself. It has an affinity for the coronary arteries for some reason. Okay, so we've got to check these, and this is what they mean. And the range for that should be less than, like, between 3, 4, and 5. 3 to 5 really should be pretty tight. Not much higher than that. And so when I see a high homocysteine, I'm thinking this lady or man is in trouble because they're not detoxing properly, and they likely have an MTHFR deficiency, gene mutation. Now, I've had a lot of questions come up in the group about tests that they would like to order, or that they, that have been ordered for them in the past, that I do not order as part of my testing. And let me give you some examples of that and why I do not order them. I don't order tests that aren't helpful. So vitamin levels, like literally just like B12 levels. I don't order those because knowing what they are in the blood tells me nothing about what's in your tissues. That homocysteine test tells me a lot more about those likely B12 levels in your tissues. And there are some other tests that we can get, like methylmalonic acid, to test what those levels are in the tissues, rather than get the vitamin levels alone, which tell me nothing. If your vitamin B12 levels are high in the blood, that usually actually means that they're low in the tissues. I'm never going to order that test. It doesn't help me, okay? Because it doesn't even correlate with that all the time. So it's a useless test. Mineral levels, same thing. It does not tell me what's in the tissues. It only tells me what you have building up in your blood, and that doesn't help me. It doesn't, if it's high, then some naturopaths or natural doctors will say, oh, your levels are great. You don't need any more. That's not what it means. If your levels of zinc are high in your blood, it doesn't tell me that you have adequate levels of zinc in your tissues, right? It does not correlate with that level. So same with like copper levels. Testing serum copper really is meaningless because it does not tell me what is in your tissues, where it really matters. And it does not, you can't extrapolate from those tests what these actual levels are. Now, there are some other, ways to test those properly, but those particular tests, I will never get just serum copper or serum selenium or serum zinc, B12. I'm never going to order those because they're not helpful tests. And I don't order the MTHFR gene mutation test simply because half of us have that gene mutation. Half. And I can tell just as well by looking at homocysteine what your O and MCV, which comes as part of your CBC, complete blood count, tells me just as much what your probable levels of B12, active B12 and folic acid are. I don't need to get that gene test. It's an expensive test anyway. We don't need to test that. So it's not very helpful. All right. And this has come to mind too, as I've talked about this. Many of you keep looking for that one thing that if you were to find it would make everything better. The truth is that it's never really one thing. That's why I want to tell you about many different things, okay? And so I had a good example of that, even just today. The lady's husband that I was talking with, we were talking together, asked me, well, is the main issue such and such? And I said, honestly, it's not that, it's a big issue, but it's not ever that one thing that if you can just fix that, everything else will go away. It's never just one thing, ladies. That's why I get the tests that I do, because I'm looking at all these different ways that our different systems interact with each other and how they affect each other. And that's how we're going to get to the bottom of and your root causes. So getting the right information from the right test is critical to finding out your root causes. And it allows us as clinicians to accurately treat and address the correct things rather than throw a Band-Aid on it and let the underlying disease process progress. It doesn't make good sense to let this happen. So remember, our bodies were created to heal, and you still have the power to heal. All right. Now, let's see if there were any questions. The first question is, high reverse T3 dangerous? Well, yes, because it's blocking T3. And there are reasons for high reverse T3 that we need to find out. It's usually stress related, usually infection related. We've got to find out and test for, find out information about that to help you understand why that might be high. And then treating the processes that need to be treated will usually help that decrease back to normal, and then it won't be so dangerous. Hazel wants to know if I can briefly describe dysglycemia again. So briefly, it's blood sugar that you have trouble regulating blood sugar. That's what dysglycemia is. And it's usually because of insulin resistance, but it can be because of adrenal issues. and low thyroid issues. So it's just a problem with regulating your blood sugar. So it can go really high, it can go really low. It can always be really high, as in diabetes. It can always be really low, as in hypoglycemia. But dysglycemia is abnormal blood glucose regulation. Margaret asked, my lab showed hypothyroid, then the last lab was hyperthyroid following your protocol. That's all the tests show. But remember, you have to put everything in context of how you're doing and how you're feeling. As you're going through detox, sometimes what can happen is that hormone levels can go higher than they should. And it's generally because your body's still trying to balance things and deal with inflammation. And when you're detoxing, and for some of you, it causes some shifts that make these hormones go higher. If you're not having hyperthyroid symptoms, you're not hyperthyroid. That's one thing that you need to understand about thyroid hormone tests. Just because they're high in your blood does not mean you're actually hyperthyroid in function. And so we have to look at the full picture. And if you're doing well symptom-wise, then those numbers don't necessarily mean that you're hyperthyroid. And you're right. And she asks, is this my thyroid correcting itself? In many ways, yes. Right? Good questions. And then what is lactic acid? And what's the difference between lactic acid and uric acid? Man, that gets really into the weeds. Lactic acid is made from pyruvate, which glucose turns into pyruvate, and that converts to lactic acid. Uric acid is certain amino acids that break down to uric acid. They're called oh my goodness. I can't remember the name of those particular amino acids. It's just escaping me right now. Oh well, it's been a long day. So purines. There we go. The purines that break down to uric acid. Yeah, they're very different, but they are acidic, and they can cause pain, which is what acids can do. Okay. Very good. Well, I don't see any other questions. And those were some good questions. Ladies, remember, it's important to get the right information. It's important to get the right tests to give us that right information about you so that we can help you even better. And remember that there are answers. Have hope, for goodness sake, have hope, because we can get the right answers in this group. And remember that you still have the power to heal. Now, thanks for joining me, and have a wonderful evening, and I will see you next time.